Good afternoon and welcome. We're here again. I'm actually on time and managed to get here without a further accident this morning. I said at the last briefing on the 28th of August that it was to be the last one that was planned before the general election, but the pandemic is clearly not going to wait for the outcome of the election, and we can't simply stop communicating in the meantime. So I am disappointed that we've needed to call today's briefing at short notice. As ever, let's cut to the chase. The single positive travel-related cases in both Guernsey and the Isle of Man and their impact on the air bridge would not of themselves justified us calling a briefing today. However, the very rapid rise in infection rates in the UK in general and in England in particular does. On Thursday last week, England's infection rate for the first time exceeded 30 in 100,000, which is, of course, is the trigger point to put it on the Group B watch list. And the trend, unfortunately, does seem quite clear, and it is in the wrong direction. If we have 7 days above this level, it will trigger a move of England from Group B to Group A, which would mean that those travelling from there would need to self-isolate for 14 days without an opportunity for a test on day 7. And of course, this has already happened in relation to Northern Ireland. The fact that England is our most common point of origin for travellers means that this would have a significant impact on all of those travelling. Of course, in recent weeks, and in September in particular, there is increased traffic, as not least as a result of students heading off to university and parents assisting with that process. So the position is, however, somewhat more complex in that actually the prevalence rates are not uniform, and different regions are clearly having different experiences. In light of this, as we've done before, we felt that it was right and proper to give as much notice as possible of our current thinking. And this, we hope, will enable the community to make informed decisions, as well informed as they can, as possible anyway, in respect of their travel plans. So, if the trend continues, our current plan is to move a number of English regions onto Group A from the early hours on Tuesday the 15th of September. In other words, 1 minute past midnight on Tuesday the 15th of September. A final decision in this regard will be taken and communicated in 2 days' time on Thursday the 10th of September. This approach is pragmatic and it's proportionate, and it's a proportionate response to the rapidly changing position in the UK. And I just want to emphasise again that this is our current thinking, and it is subject to both change and a final decision. As ever, with this pandemic, events are, of course, fast moving, and we've got to remain dynamic in our response. It is possible that other regions across the UK will be added in time too, depending on how things develop. And this could, of course, happen at relatively short notice. So anyone planning travel must do so knowing that there are risks that the rules for their re-entry to the bailiwick may change whilst they're away, and take that into account. Now, this move gives rise, I think, to a raft of different questions, including if you're travelling from Wales or Scotland or another Group B region or jurisdiction and transiting through a Group A region, would you still need to self-isolate for 14 days? And Nikki and Heidi are going to go through a presentation in a moment and address that issue. With rising infection rates in lower age groups and no significant increase in death rates, why does the trend in England matter? And again, Dr. Brink is going to speak to that as well, and explain why we simply cannot ignore this development in England. And would this move impact on any decision by the CCA to the introduction of Phase 5C? And the decision to that, or the answer to that, I should say, is no, not necessarily. Once we've actually got all the infrastructure in place, we can still activate phase 5C in respect of Group B areas as and when the CCA decides that it is the right thing to do. What about compassionate and medical travel? And again, Heidi and Nikki are going to speak about that in a moment. So I want to restate once again, as we have many times in recent months, that the elimination of the virus from our community is not the objective. It's not the objective. But managing and containing it is. And the reason that we want to manage and contain it is so that we can continue to allow our community to go about their normal working and social lives as normally as possible and without fear. And that absolutely is in the best interests of islanders' mental health and well-being, our education system, and our economic and business life. And so that is very much informing our approach and response to the evolving situation in England. So that's enough from me, and I'm going to hand over now to another double act. So Heidi and Nikki.
Thanks, Kevin. Thought we'd just briefly go through where we are now. I think people will be quite well aware, but it's just always useful to recap. So we've got 3 different countries that we put countries into. Group A, where you have there's a high prevalence, so countries like the US, France, and Northern Ireland is now, where anybody travelling to those countries, when they come back, they need to self-isolate for 14 days. Group B, currently England, Wales, Scotland, other parts of Europe, test on day 7, and self-isolation until you've got your negative result. And if you haven't got a negative result, then you have to self-isolate for 14 days. And then we've got Group C countries, which at the moment is just the Isle of Man, where we have no restrictions, where the risks are very low. So phase B, our update from when we spoke last time. We had clearly Isle of Man over the weekend announcing their new travel-related positive case, and we also announced our travel-related positive case. No connection between the two, but that is what's happened. Testing regime and self-isolation is going to be crucial for the future. As we said all along, that the borders are our weakest link when it comes to the bringing in of the virus, and so that's what we've spent an awful lot of time, and Nikki and her team, building up the testing regime and tracking and tracing. So we're well prepared for anything that comes along. And the team have been working very hard on looking at what 5C looks like. Any of you passing through the airports or the ports will see the work that's been going on at the moment. Okay, well, I thought it was be useful now to do a bit of myth busting. Firstly, just to reiterate, there's no connection between the Isle of Man positive case and the case we picked up on Sunday. And also, I think it's worth mentioning here that neither does a case in either island mean the end of the air bridge. Both cases were picked up from travellers, and the risk of transmission is extremely low. It's also worth saying that whilst this is our first case, it has been picked up for months. That is a direct result of bringing in the 7-day testing regime. And it is quite possible that someone has come in with the virus before now, and they may have been asymptomatic, but we wouldn't have picked it up with 14-day self-isolation. But it didn't matter, and we wouldn't have known, but they would not have been infectious after that time. The fact we picked up the case through 7-day testing is a good thing and shows the system is working and is actually what we expected. Now, I'm more aware that there are also rumours circulating on Friday that we had a positive case then. We didn't. The positive case was tested on Sunday and we got the results later that day. The fact it is so soon after Friday is just a coincidence. Although I wonder whoever was spreading the rumours might want to change a job in terms of doing betting or guessing what the markets are going to do, because it was quite prescient that it actually happened on Sunday. Then I heard today that apparently we've had a second case. Well, that was news to me, and I only just heard it just now. Again, we haven't. So for whatever reason, the number of false rumours being spread on social media has been growing over the last couple of weeks. And I would ask anyone reading or hearing supposed facts to ask whether the person putting them forward is a trusted source and not just a friend of a friend who supposedly knows the real truth. These false rumours help no one. Indeed, they can cause fear and anxiety and have a really detrimental impact on the most vulnerable in our society. Since the beginning, we've said we would be open and honest with you, that we would not get everything right, but we would tell you when we hadn't, and that when we had new information, we would let you know and advise you what our plans were as soon as possible. And that's what we're doing today.
So, thank you. So, as Deputy St Pierre said, the number of cases in the United Kingdom have been increasing, and indeed on Monday this week, the United Kingdom reported just under 3,000 cases in a day, and that was the highest number that they'd had since May this year. So it's something that we need to take note of. Now, we extract our primary data from the data supplied through the European Centre for Disease Prevention and Control. And there is sometimes a bit of a lag in the data that we present. So if we focus and look at the graphs that we've had, if you look at England, it'll appear that the numbers are tipping off in recent days. That is the data as it's extracted, but we think there's a lag in reporting, and actually there'll be an increase in those numbers. So really important when we analyze the data and look at it. Now, we've always wanted to look at the data in firstly as accurate a way as we can, but also in a way that promotes maximum ability to travel and move around for people within the bailiwick. So initially what we did is we separated off England, Scotland, Wales and Northern Ireland. And if you can see, as I've discussed where we are with England, looking at Scotland, you can see that the numbers are gradually creeping up in Scotland. And of course, there are some regional lockdowns there. Going on into Wales, the numbers are increasing slightly, or increasing there. They're still under, just above the 20,000 now, just about hitting 20 per 100,000. So important to focus on that. And of course, there's been a local lockdown in Wales as well. France, we look at closely because of its geographical proximity to us, and the latest data from France is showing that the numbers are above 120 per 100,000. So considerable increase in numbers there. Germany has remained relatively stable at around 20 per 100,000, and if we look at Italy, Italy has increased in recent times as well. So in the surrounding areas and in areas that our population travels to, we are seeing a gradual increase in infections. And that's really important as we move forward. But what we also want to do is not only look at it on a countrywide basis, but also look at the regional analysis. So we've been working on a regional analysis map and looking at how we can move forward. And what we want to do is look at the prevalence of infection in different regions within England, and that will then enhance travel opportunities for people living in Guernsey. So the CCA obviously are going to have to look at the recommendations, and they'll be looking at those and looking at when we introduce them. And Deputy St Pierre mentioned that from the 15th of September. And what we want to try and do is allow areas to stay as Group B areas as long as we possibly can. And that's really important. Now, we selected a prevalence for travel at 30 per 100,000, a prevalence for our Group B. So anything under 30 per 100,000, we classify as a Group B country. We want to keep as many countries and regions in the Group B category for as long as we can, which is why we want to move forward and look at regional classifications. And we started off with England, and we've also looked at France as well, but we're going to be looking at other areas such as Scotland, Wales and Northern Ireland, Republic of Ireland as well. So again, as I said, it's to maximise opportunities to move around for our citizens. So this is our map that we're going to use, which shows the regions that we're looking at within the UK. And what we will be doing is updating this on a daily basis. So again, a bit like our A, B and C country classifications, we'll then be updating our regions. Now, we've been running this for the last week to ensure that it would run smoothly, work smoothly. And what you can see from that, if we were to do the classification today, both the northeast and the northwest of England would be classified as a Group A area, as would Yorkshire and Humberside and the West Midlands. But places like the East Midlands, the east of England, southwest, southeast of England would all be classified as Group B areas. So I think that's really important as we move forward, and that will then give people the maximum ability to travel, but also to look at the areas that are considered to be of lower risk. So from our perspective, that's important for moving forward, but we also wanted to try and define what the transit rules were. And we looked at a variety of things that we could do, and we thought it was a case of keep it simple. So if you've transited through an area in a private vehicle without having contact for anyone, that doesn't count. However, if you've gone on public transport through an area, or you've got out, spent some time in that area, that then counts as having been in that area. So it's to try and find a very simple, very smooth way of operating a regional policy. Heidi.
As Nikki has said, those regions currently falling within the Group A parameters, so a prevalence of over 30 and 100,000, are in the Midlands and the North. So if that remains the case, the majority of those requiring medical treatment in England won't be affected. However, for those who may need to receive treatment in a Group A region, we will retain the process we had in Phase A, which is effectively testing on day 7 with passive follow-up if the test is negative. In addition, those needing to travel to a Group A region for compassionate reasons will be considered by public health on a case-by-case basis. Now, clearly this isn't a great time to have to make any changes. Parents need to take their children to university. That's why we're giving as much notice as possible of what we may need to do if the situation in England continues as it's been doing recently. The current trend isn't looking positive, as it isn't in France, which, as you've seen from the chart earlier, is recording more daily cases now than earlier in the year. So whilst we're hoping for the best, we really have to prepare for the worst. That includes considering how we deal with children and young people at school and university in the UK. And as always, we will be taking a risk-based approach. And by looking at the data at a regional level, which public health are now able to provide, we can ensure our decisions are appropriate and proportionate to the risk.
Great. Okay, well, thank you very much. So we'll throw it open to questions in a moment. But I'm just, Nikki, one question that I touched on when I spoke, and I just want to address early, is as we follow national media and indeed international media, the coverages around infection rates are generally, whilst they're increasing, it tends to be in younger age groups, under 40s, and more particularly recently in England in the 17 to 21 age group, who we know are largely unaffected. Could you just explain, and we also know that death rates have not reached the levels they were early in the year. Could you just take us through why, given all of that information and that sort of apparent progression of the virus this time round, we need to worry? You know, why can't we just ignore it if it doesn't appear to be doing any harm, and that it's an issue that we need to take seriously?
Well, I think we need to take note of the infection rates, as Deputy St Pierre said, and have a look at what age groups are affected. So it is predominantly at the moment the 16 to 21-year-olds. And indeed, that group are likely to have a very mild infection. Some of them will have almost no symptoms at all. And I think that's important because although they may have very few symptoms, and indeed very few will require hospitalisation, they are able to then spread it within the community and spread it to older people in the community. So I think it's important that you look at the impact of the infection, the 17 to 21-year-olds, and the possible of transmission to older people in the community. And that then would impact on the hospital and would impact on death rates and so on. So I think it's looking at the knock-on effect from those infections in the younger age group and the possibility to transmit to older age groups who indeed are likely to have more serious complications.
Nikki, isn't that the case that's been happening like that in the US, where it started amongst young people and now it's passing on to the older generation?
Exactly. And where other areas are starting to report no definite trends, but patterns that are suggesting that you could see older people becoming infected.
Okay, good. All right, thank you very much. Let's open it up to questions. Who wants to start first? Yes, in the middle.
Ewan Duncan from BBC Guernsey. Dr. Brink, a question for you. If, considering yesterday we were told about the first case, and the statistics show that it was the first case out of 1,263 people that have been tested on arrival at either port since the start of 5B, and they're now testing after day 7. Now, if say, regions of the UK get added to Group A and therefore it would mean 2 weeks of self-isolation, surely the system that picked up that one case over the weekend and we were told about yesterday, surely it shows the system's working and that we don't actually need to go to this. We can continue to carry on like this because actually 1 out of over 1,000 people is a really low number. And as we know, they didn't spread it in the community. They were self-isolating. So surely there isn't any harm for the community to carry on the way we're doing.
So we're looking at upscaling the amount of travellers returning, entering the bailiwick to about 1,000. We're going to have the capacity to test 1,000 travellers a day as we move on through the phases. And I think that's a really important question. So 30 per 100,000 equates to about 1 in 3,300. So if we're looking at upscaling the number of travellers coming into the country, or coming into the bailiwick, we're looking about 1 every 3rd day coming up positive, and we think that our track and trace can cope with effectively and contain. Obviously, it's not an absolute guarantee, and everything we do now is increasing the risk, but it's trying to do it in a proportionate way. So I think one of the things that we will have as we move through Phase B is we'll have a greater database of what the prevalence of infection that's coming into the community, coming into our community is. And we will always relook at the data as it comes available. But I think from now, we need to assess what the prevalence is and work out where we are. And yes, we'll always look at new data as it comes available, absolutely.
But I don't think we are seeing an increased number of people because the flights are only to Southampton. The links aren't there to have many more people than we're already seeing.
But we're looking at moving on from Phase B. This is not a static situation. So what we need to look at is not what we're modelling for the next week, but what we're modelling for the next 5 months. So we're looking at how we have a sustainable solution for the next 5 months to keep our bailiwick moving as much as possible. So looking at it in a singular fashion week by week means that you will chop and change all of your policies on a regular basis. So what we want to do is look at how we can have a sustainable solution for the bailiwick. And that is the reason why we're trying to model, we are modelling 5C, and how we can bring less restrictive isolation. And when we bring in 5C, you're looking at only probably about 24 hours of isolation after arrival with a second test on day 7. That again would increase our risk profile. So if you test someone on day 7, is that there are some people that would have already resolved their infection. So it's looking at how we move on and have a long-term or a medium-term solution rather than working week by week.
Okay, next question. Yes.
Maisie Foot, Bailiwick Express. Dr. Brink, if regions of England are moved into Group A next week, what sort of indicators will you be looking for to move them back then into Group B?
Yeah, okay. So basically, we'll use the same principles as we're using for our country classification. So if a country hits more than 30 per 100,000, they go onto the watch list. They need to be on the watch list for 7 consecutive days, before they go into Group A. So we'll be using exactly the same criteria for moving countries backwards and forwards, and we want to keep that really constant. What I showed you today is a snapshot of if we were going to do it today, it might have changed. So some of those regions are actually tipping down now. So, in fact, when we show this to you next week, when we publish it next week, it may not be the same. So this is not what is going to happen necessarily next week, but we're starting to map that out. So the same criteria as we use for country classifications.
Okay, thanks, Maisie. In the middle.
Zoe Fitch from the Guernsey Press. If the UK does move to Group A or some regions, will that have any effect on business tunnels?
Well, first of all, just to emphasise, it's not the UK. We're talking about regions of England at this stage. But the question remains valid. And I think at this stage, the view would be that the protocols in place for business tunnels would still be sustainable to allow that to happen.
Yeah.
That's, I think, the public health view.
Yeah. So the protocols for business tunnels are written to prevent infection occurring. So we would be happy, whether it's a Group A or Group B region, for the same business tunnels to be operational.
And again, it's about mitigation of risk and recognising that the numbers through using the business tunnels have remained very low and therefore a very controllable event, if you like. Next question. Yeah, Keelan.
Keelan Webster, ITV News. How will you check what regions people are coming from when they come into Guernsey?
Do you want me to answer?
Yes, please. Thanks.
So exactly the same thing, it'll be through a travel declaration.
And again, so there is a reliance, therefore, on the individual, and it'll be, as there is at the moment, of course, if somebody comes from outside the UK, the need for them to provide an honest declaration, and of course, if they provide a dishonest declaration, that will be a breach of the regulations of the law, and they'll be subject to potential prosecution and penalty if they do so. So. Hopefully that isn't the case. I mean, as ever, the experience clearly through the last few months has been a high degree of compliance on the basis that the vast majority of the population does not want to be the individual who's responsible for seeding this back into the community. So I think we are relying very much on that. One reason for again giving advance notice of this is to allow for some of the logistics and operational changes that will need to be made to things like forms, so that again we can identify the region. So that work is already ongoing this week, so that if the decision is made on Thursday, we're ready to go from 1 minute past midnight on Tuesday.
And we get more people checking with us that they've declared enough. So we get a number of queries to public health saying, I just want to check that I've completed this correctly. So I think there is a high degree of public acquiescence with the form completion.
Okay, thanks, Keelan. Ewan.
Dr. Brink, many people will be concerned if they're travelling and certain regions did move to Group A, that if they transited via Southampton Airport, and at this stage obviously Southampton is in green and wouldn't be moved, but in the future if it did, if you're going via Southampton and, as you say, then you'd be travelling by public transport, so you would then fall into the Group A category. But say you only transited for an hour at Southampton Airport, you wore your mask, you stay away from everyone else, and you're being penalised really for being in that area. But realistically, where else can we fly to?
I think, as I said to you, it's not a static situation, and if a Lifeline route changed classification, would clearly have to consider what mitigations we could put in place. So what we've done at the moment is look at the regional classification, but if a Lifeline route was reclassified, we obviously would reconsider and look at how we can put mitigations in place. And indeed, we've already started looking at how we'd put various non-pharmaceutical interventions in place, should that be the situation. So we're always trying to think 1 or 2 steps ahead.
And with the Lifeline route, we might look at a more specific area for a start. If we understand that it's important for Islanders to get to, we might be able to hone down that region specifically. But at the moment, South West and South East are well under the threshold, so we don't have to worry about it right this moment. But we've got to monitor the situation all the time, and that's what Public Health are doing.
So they're both South West and South East are under 20 per 100,000 at the moment.
I think it's worth emphasising that there's absolutely no desire on anyone's part to require individuals to undertake 14 days self-isolation unless it's absolutely necessary. So in a sense, the rationale for the triggers is about understanding our ability to be able to mitigate and manage and control the risk within the community. Otherwise we wouldn't be doing it, because we know from the months of experience of requiring 14 days self-isolation how difficult that is for people and all the mental health and well-being challenges it presents. So it is absolutely the last resort in terms of it's not a step that's being taken lightly. But we do recognise that travel numbers have increased, and there are people who are now needing to travel, and so hence the reason for giving as much notice as possible to try and allow people to make appropriate travel decisions in light of the evolving situation. Okay, next question. Yeah, another one from Ewan. Yeah.
I know that we've constantly, all the media here have talked about comparing us to Jersey, and constantly you'll tell us that every jurisdiction has to do what's right for them. But if we look at their stats since the 3rd of July and their border policy changed, they've done 63,500 tests on arrival at their port, and they've only found 46 positive cases. And if I've done my maths correctly, that's 0.0007% of travellers that they found a positive case. there's now sort of murmurings in the community that are possibly saying maybe Jersey got this right and maybe we didn't.
We give a consistent response to that challenge, which has been the case, as you've said. Every jurisdiction needs to do what it thinks is right. We are making decisions from a different place, in the sense of where our community is in a different place to where Jersey is. We have been open for our economy, our community, our education system has been open for longer. It is completely open, and the community's expectations around what they can do, and particularly for those that are vulnerable or shielding or merely suffering anxiety around this, that is largely alleviated from where we are. So you cannot easily compare any two jurisdictions. It is not comparing apples with apples. So I understand the question, and it's an inevitable question, particularly given our geographic location so close to Jersey. The reality is, as we've said before, it is probably only with the benefit of hindsight, when this thing is over and the studies are written by people like Dr. Brink and others in her profession, that there will be an analysis of which strategy was right and what the consequences were for the economy and what the consequences were for the community. There are lots and lots of different parts to that question. It's not just about the percentage of the number of tests that are positive or negative. It's a more complex equation, I would argue, but others may have.
Well, I'd say anywhere which has more open borders has more restrictions within its community. So having to wear masks on public transport, social distancing in restaurants, schools with all manner of different precautions in them because of the greater risk of spread. We haven't got that. We've had events throughout this summer. I was at the Ricane Regatta on Saturday. It's absolutely fantastic seeing you play. But where else could you do that, where the whole community could come together and not worry about things? That's what we've got now. If we do say what Jersey do, that will come with compromises. I haven't heard that people want those compromises at the moment, but as Gavin says, benefits of hindsight in the future when this is studied and people say, well, no, actually the community would have liked to have had all these restrictions on Ireland. They didn't bother about all these events. It didn't matter very much. But I don't think that, I think most people are quite happy having what we've got. I don't think tourism in other jurisdictions has rocketed because of slightly open borders, quite frankly. The numbers you referenced don't say to me that there's been an influx of people wanting to go on holiday in different places. So I just think we have done what we thought is best for the people of the Bailiwick, and that's where we are now, and we have to consider the actions we take now based on the position we're at.
Anything to add, Nikki, at all?
No, other than to say some of the things that have been expressed to us within public health are, for example, that our children went back to school on the 8th of June. And so they were back to school in an unrestricted environment, and parents really value that. It also enabled parents who are working to get back to work themselves. So I think it's looking at that, and some of the feedback that we had from that was extremely positive. And I think as we go into the new term, again, allowing children to get back to school so parents can get back to work, so our whole economy, community gets moving, I think has been very important to our community. But as Deputy St Pierre said, is only when we look back on this will we be clear as to what exactly the precise, whether there's ever going to be a right or wrong, or whether it's just going to be a matter of opinion, a matter of views.
Okay, any more questions? Keelan?
Just in light of that, what is your sort of message to the hospitality sector at the moment, who were probably, some are saying, we do need to open as soon as possible and it's been too long?
Well, hospitality needs to be distinguished between accommodation and the rest. I mean, clearly hospitality is actually trading pretty well. A lot of the hospitality sector is trading well because of the support from the local community with the absence of social distancing and so on. So the accommodation sector and those more reliant on inbound clearly are suffering. We know they have been for some time. We know that the package of support is important to them, and we're continuing to review that and consider their needs to get them through to a more normal trading environment. So I'm afraid the message to those sectors of our economy that are particularly impacted by the current strategy I'm afraid the message hasn't changed. It's other than empathy, understanding, and a desire to try and support through a very difficult patch. Anything else? Yeah, Zoe.
Are we able to get an update on where we are with establishing testing facilities at the ports ahead of Phase 5C?
Anyone in a position to give that
Yeah.
practical update?
I think that's progressing as planned. So we're looking at the designing of the booths. So those are all being built, as I'm sure you're aware. We're waiting the delivery of the robot. So we're planning for how we process large numbers of samples. I think what has been immensely important to us is that we've upskilled local people to do all our molecular analysis. So we own the kit. We've got an upskilled workforce who are going to look at performing all of the molecular assays. So I think that's been enormously important to us. So I think we're progressing to deliver on that. But on top of that, we're also looking at the winter planning. So we need to be absolutely clear about delivery of winter planning. So we're modelling what a winter season could look like and how we'll deliver symptomatic sampling together with port screening together, so that we're able to provide both services to people living in the bailiwick. So that's together with the planning for a vaccine. So those three work streams are progressing.
The only other thing I would add in relation to that is the Civil Contingencies Authority has only really become aware in the last week or so that there are challenges around outbound passengers because of the hold baggage issue, which has, I think, just gone into the public domain in the last 24 or 48 hours, with the equipment there needing to be replaced and the requirement that some of the hold baggage is hand searched. Now, clearly, all the planning from logistical planning has been for managing people coming into the airport. Now we need to understand the implications for any delays in getting people out, and in particular understanding whether it has a knock-on impact on schedules. And because what we can't have is obviously a whole load of flights arriving at the same time. So if flights are going to be delayed because of problems getting through hold baggage, so that's a late issue which we weren't aware of, but we are conscious that we need to understand and that there is a solution and that it is being well managed by the airport, so that we that doesn't become an impediment to us actually triggering 5C as and when we are ready to do so, because that would clearly be unfortunate. Ewan?
And in terms of 5C, are we still looking possibly the middle of October?
There's nothing to add from the briefing on the 28th of August. Nothing has changed, as Nikki has just said in response to the previous question. Things are on track in relation to getting everything in place. No further discussion or decision has been made by the CCA. That will be made in due course as and when the time is right. So I'm afraid I can't give any further clarity on that at this point. There's been no developments. Yeah, Keelan.
Is there sort of a statistical trend or a situation which would delay a move to 5C?
Well, again, I'm probably going to pass that to Nikki, because that's probably best phrased in the context of really everything we're talking about today.
Yes, okay. So what we're doing is we're developing a ladder of triggers that we'd be concerned about. So we're currently in our current situation with single import travel cases. We're then looking at a cluster of travel cases. We're then looking at an individual case of community transmission. We're then looking at more than one case and sustained high-level community transmission. So we're aligning all of our actions against the 5 outcomes. So these are triggers going backwards and forwards, and we always said that we would be very precise. And what we're doing is we're taking every non-pharmaceutical intervention and aligning them back with those different scenarios that we could face. And with those, we would then look at when we would consider that we need to pause where we are. So we're looking at that in the whole, and I think that's really important that, again, we use evidence to actually look at the various stages and say, well, if we're in this stage, this is a suite of actions that we think we'd need to take.
And just the only other comment I would add is a comment you made earlier, Nikki, is just emphasising the point that the prevalence trigger of 30 and 100,000 to take a jurisdiction or an area or a region into Group A is, of course, part of the process of enabling us to manage our resources so that we don't become overwhelmed in terms of the testing required as prevalence rates go up. Now, clearly, again, as we've indicated, all of that may change in due course, may continue to evolve. That number might go up or down as this continues to evolve. But in terms of your question, if suddenly it went to 50 in 100,000 or 150 in 100,000, as following the trend in France, that in itself would not necessarily impact the decision on phase 5C, because actually you're using that as one of your controls by moving the jurisdiction into Group A anyway. So you're therefore already putting a good chunk of people into self-isolation for 14 days. So you've got to remember that that's part of your suite of measures that enable you to carry on enabling travel. Is that the fair
That's
analysis?
absolutely correct. And if our local prevalence was up within our community, we'd then look in a sequential way at what interventions we had to put place in the community. We wouldn't just roll back to an earlier phase. We'd say, well, these are targeted things. It's these circumstances that we think are leading to transmission. So let's put an intervention to stop that. So it'll be a very precise intervention that we look at. And I think that's really important as we move forward.
Yeah, but put it another way, the prevalence rates don't necessarily decide whether we go into 5C or not. What it will just determine is whether travelling from those countries enables you to take advantage of the 5C opportunities in terms of testing on arrival and then testing after that.
Yeah.
Excellent. Any more questions? Run out of questions for today? No? Okay, well, thank you very much. And I won't attempt to make any prediction as to any future briefings. I think we'll just close it off there. Thank you very much indeed. Thank you.